Recording in progress.
Good afternoon, everyone. Thank you for joining us. This is the weekly media briefing and public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. James Ridgers, who is the Director of the Department of Health and Human Services, Dr. Nina Ashford, Chief of Public Health Services, and Dr. Earl Stoddard, Assistant Chief Administrative Officer. Thank you, everyone, for joining us, Mr. County Executive. It is great to see you, sir.
Hey, it's actually good to be back. It's nice to be able to talk without coughing. So I'm finally seem to be making progress with this. As you may have noticed, many of you, I missed the last two media briefings, and I want to thank you for your patience. It's kind of rare for me to be out of work. I usually don't take days off, and I usually just plow through. This time, that didn't work really well. I was sick for, last time I was this sick, it was my 15-day adventure with my first COVID infection. And this was actually worse than my COVID infection, except for the 2 bad days in the beginning of COVID. It was just irritating. The last couple of weeks have been seriously irritating. This week, I actually can talk without coughing, so I'm good to go. And I appreciate everyone who helped cover during that time. And Rich, thank you so much for keeping these briefings going so that people can continue to get the information we want them to have. So I want to first start talking about the budget that the council just passed last week. I appreciate the council's collaboration and their strong support for public education. I'm glad we were able to come together and fund 99.8% of the MCPS request, resulting in a record $3.58 billion investment in our schools. This is going to help fund the salaries, address serious gaps in our special education staffing. They are adding or going to additional 700 full-time staff positions for special education. About half of them are coming by taking part-timers and turning them into full-time, and the rest are new hires. But this has been really important, and the problems with special education have actually been impacting regular classrooms. We also have money in there to improve school safety, and these things are and were needed now, not later, and it's good to see that the schools are getting the funding they need. To fund the big increase in requests from the schools, the council chose to redirect funds that were assigned to be deposited in the Montgomery County Public Schools portion of what is known as OPEB, which is basically future and retiree benefits, health benefits, and it's a trust fund set aside for future health care costs. For future for future retirees. I was comfortable using these funds for the schools because the OPEB trust is well funded, and I proposed something similar last year and it had been rejected by the council. So I didn't go back at that again this year, but I'm glad the council arrived at that solution. It is the right solution, and I'm glad we're doing it. The using of OPEB helped, and it could be part of a future solution. And hopefully now we can have a conversation about what we're going to do about future funding. These needs are not going to go away. The blueprint may see delays, but the blueprint is still on track to be implemented. And the blueprint comes with costs, and in particularly comes with costs related to early childhood education. So we're going to have to think about how we deal with the future as we go forward. This is not simply the school system adding new programs to an existing budget just to see what works. Is actually things they need to do, and early childhood is something we need to do. Over the next year, we're going to need the council, the Board of Education, MCPS, and our labor partners to work together on how we can fund the necessary increases that we know we're going to be facing in the future. I'm glad that the council also kept reserves above 11%, as I'd recommended. We're in a tough environment, and having reserves above the recommended 10% puts us in a better position to deal with any mid-year changes that come our way. And I think we're pretty sure that we're going to see some mid-year changes from the federal government. We also made real progress with this budget. We committed a record $312 million to affordable housing. We invested $366 million in climate and environmental actions. We made Ride On Fare Free, which improves access and equity, and we added 300,000 for East County dental services. And we're expanding emergency response and launching new tools like the Drone as First Responder program. That program is getting further expansion, and I give the police department a lot of credit for both the drone program, but also for other research they're doing into ways we can use technology to improve policing, help keep people safer, and help our police be more effective in the work they do. We're also continuing to invest in the economy. This budget builds on the momentum with new funding for business incubators, workforce development, and support for small businesses and displaced federal workers. I want to thank our residents and everyone who attended forums and testified, wrote letters, and stayed engaged. Their input helped shape the budget, and I look forward to our FY27 community budget forums that will return in the fall. In our future deliberations, we'll continue to propose solutions to help make the county more inclusive, more resilient, and more sustainable, with an economy that works for everyone. We are going to get a new North Bethesda. I'm really excited about this project. Yesterday, we had an exciting moment for economic development and scientific research in Montgomery County and in the state. Yesterday, WMATA announced that Hines, the developer, would be master developer for the 13.9-acre site next to the Bethesda North Metro Station. This is the future permanent home of the University of Maryland Institute for Health Computing, sometimes called UMIHC. This is a major step forward in a project that I've been working on since I became county executive. We often talk about the need to increase economic development of the county. There had been little action on how we do it in a way that uses our strengths and put us on a path to growing good jobs. IHC and the Metro Station development is something that I initiated more than 5 years ago when I went to the University of Maryland and asked them to bring graduate level research here. I pointed out the incredible resources we have in the life sciences industry, and it would be a center using AI to drive drug discovery and medical research. I discussed creating a collision spaces where scientists can meet, gather, and share their ideas and advance their work, and where they can interact with others in the life sciences industry. I knew it needed to be on transit in a prime location. I kept thinking about Kendall Square, which I had been schooled about many times by people in the science community. So at the same time that I approached University of Maryland, I also approached WMATA about the North Bethesda Metro site, which is on 355, close to NIH, NIST, and other critical life sciences assets. I suggested that we do a project, a joint development project that would result in turning this into a hub for life sciences. And this development is going to anchor for life sciences and artificial intelligence in the region, and a turning point in our efforts to create a walkable, transit-connected innovation hub in North Bethesda. This is the right project, this is the right place, and this is the right time. And it will be a catalyst for more development in the area with currently vacant White Flint Mall nearby. We'll probably have more good news about that soon, but we continue to make sure that we're driving as much economic development, and particularly high-quality economic development. One of the things I've been focused on is I'm not interested in blanketing the county in retail and services where the workers earn such low wages they can't afford to live here. Our focus is in bringing in high-quality jobs into the county so people can earn reasonable wages, have opportunities to rent and buy homes here, and have opportunities to help lead the county as one of the centers of life sciences. And that's what, is making this project stands out and what's turned people's heads when I've talked to people not only abroad but elsewhere in the country is the University of Maryland Institute of Health Computing. I've talked about this partnership at national conventions like BIO, most recently at the ICSC, the big shopping center conference in Las Vegas. I've talked about it overseas when I've met with business leaders and investors. When they hear that we're bringing together AI, clinical data, and life-saving research in a metro-accessible location between NIH and the Shady Grove Life Sciences Center, people want to know more, and a lot of people want to be a part of it. UMIHC is already up and running with more than 100 people working in a nearby temporary space. And that's not just talking about innovation, they're actually delivering them. And the commitment from the University of Maryland system to make this their anchor location has been critical in getting to this point. And I want to thank the governor for announcing his support for the project on this site. This announcement also comes on the heels of a strong month of economic development in the county. We recently announced the county's first ever tax increment financing package to support Viva White Oak, a project with enormous potential in the East County, 280 acres of sand and gravel pits that are going to be transformed into a hive of economic activity and housing. And through our new MOVE grants, we helped PowerSolve relocate their headquarters to Rockville, and Bernstein Management moved their headquarters into Bethesda. These wins show that our efforts are working, and that's because we're building strong coalitions between local government, the private sector, our state partners, and our congressional and state delegations. I especially am appreciative of Governor Moore's leadership and the support of our Montgomery delegation. By working together, we can create jobs, drive innovation, and invest in the kind of industries, bio, life sciences, and tech that are shaping the future. There's more to do. This is a big step forward, and we've got plans on how we're going to achieve even more. Later yesterday, I went over to see the governor and a roundtable that was being held at Montgomery College. I was joined by the governor, along with Secretary of Higher Education, Dr. Sanjay Rai, State Superintendent of Education, Dr. Carrie Wright, MCPS Superintendent, Dr. Thomas Taylor, and college leaders from across the state. And at the roundtable discussion, the governor unveiled his Fed to Ed initiative. Governor Moore announced $1 million in state grants to help launch this program, including $100,000 from Montgomery College to support outreach, advertising, and standing up this work here in our community. The goal is pretty straightforward and it's pretty smart. Take people who've been displaced by recent federal job cuts, including employees, contractors, NGO staff, and vendors, and help them become teachers. We have a clear need. Like most jurisdictions, Montgomery County is facing a teacher shortage, and the governor made a compelling case that we need to move faster to get qualified people into our classrooms, and I agree. At yesterday's roundtable, the governor asked what I think was the most important question of the day, and it's sort of like, how do we go faster? That's the right answer, because the need is real for our students, our schools, and for talented people in the region who want to continue making a difference. I think anybody who's followed schools knows it's often been very hard for a person to transfer from private sector work into the school system. Regardless of your talents, your degrees, or any of those things, you usually have to go back and get a second degree. Myself, I'm somebody who went back and got a master's degree while I was starting to student teach in Montgomery County, and that became my second big career. As someone who has changed careers to become a teacher, I know firsthand how fulfilling that path can be. I would say, and I always would tell people, and I'd still say it, that every day something happened where you felt like you made a difference. It doesn't always even happen in government on an everyday basis, at least not at the level that many of us work at. But in the school system, when you're in a room with 20, 25 kids and you see lights go on and you see kids making progress, you know that the work you're doing actually matters. And I know that people coming from federal agencies, nonprofits, and tech fields have a lot to offer. They understand systems, communication, and they understand real-world problem solving. And these skills can absolutely enrich the learning experience for our students. So I want to thank Governor Moore for his leadership and our partners at Montgomery College and MCPS for help turning this idea into a program. We look forward to supporting Fed to Ed and promoting it in upcoming media briefings to get the word out and to bring more great people into education. Back in the world of health, before I turn it over to our health team, I want to say that we have new federal guidelines announced by HHS Secretary Robert Kennedy and the CDC stating that healthy children and pregnant women no longer need to get the COVID vaccine. That was not supported by actually any scientific data, and it comes a week after Mr. Kennedy said, no one should take medical advice from me. But here we are, more medical advice from the man you shouldn't take medical advice from on his own word. That's not just wrong, it's dangerous. And it's insulting to science and the people who work tirelessly to save lives during this pandemic. During COVID, Montgomery County had one of the highest vaccination rates in the country. And as a result, we had one of the lowest death rates and case rates among large jurisdictions. It's not a coincidence. That's cause and effect. The vaccine saved lives, period. The new guidance upends a good policy, and it's not based on science. It's another sign that we're living what Gore Vidal used to call the United States of amnesia. We're talking about something that happened just 4 or 5 years ago, killed a ton of people. It's not ancient history. It disrupted the country and made it very difficult to carry about a normal life. And I don't know how they can forget about this quite so quickly. I don't know how the most scientifically advanced health agency in the world can now ignore the very science that helped us get through this. And I've always told people I'll stack Montgomery County up against any place in the country for what we did during COVID, because the work we did and the way we limited contacts and made sure that people stayed safe paid off in lower death rates. And if our job isn't to make sure that we minimize the amount of damage and deaths in the community when we have the opportunity to do it, I don't know what our job is. We had the opportunity. We did the right thing. It shows that what we did worked. It's kind of chilling. It's a bit infuriating. And honestly, unfortunately also, it's a sign of times to come. They don't need no evidence to do things that they want to do. We're going to keep doing what we've always done, follow the evidence, protect our residents. We're going to speak truth, no matter how politically inconvenient it may be. And with that, I'm going to turn things over to our health team for their latest updates.
And Dr. Bridgers, do you want to start?
Sure. Thank you, Dr. Asher. Before I turn it back over to you, thank you, Mr. County Executive, for your passionate explanation. The Department of Health and Human Services will continue to and always use evidence-based practices for our work, be it health, be it clinical, be it prevention, be it education. We will follow the science and the data, and as you so eloquently articulated, this was our key to success. I will stop there. I share the passion, and as the director of the Department of Health and Human Services, we will continue to let medical science guide our practices and worry less about litigation. Dr. Asher, I'll turn it over to you now.
Thank you, Dr. Bridgers, and I would just echo the sentiments both by Dr. Bridgers and County Executive Elrich. We know what the science says about vaccinations and the effectiveness of vaccinations, and even if you are a healthy individual, we know that herd immunity is incredibly important, and when healthy people get vaccinated, it protects those that they have identified as higher risk. We also know that there are folks they did not identify as high risk, such as pregnant women, and the science is very clear that pregnancy does increase your risk for adverse outcomes from COVID. Also, when we look at high-risk groups, it's those little itty-bitty babies who are less than 6 months old, and we know that one of the best tools we have to protect them is to get their pregnant mothers vaccinated, even if they are healthy. So as Dr. Bridger shared, we will continue to follow the science. I think we're going to wait and see how this plays out as far as insurance coverage and the ability of individuals to access it and supply of vaccines from Pfizer and Moderna and the other vaccine producers, but we will continue to follow and share information with our residents as it becomes available. Thank you.
Thank you, Dr. Asher, Dr. Bridgers, and Mr. County Executive. Dr. Stoddard, do you have any remarks today?
Nope.
Okay, so we can open it up for questions from members of the media. Please raise your hands. General questions for the County Executive. Mariam Shassad, Montgomery Community Media. Good afternoon, Mariam.
Good afternoon. Thank you. County Executive, there was a statement yesterday from the Department of Corrections about a recent ICE arrest, and it sounds like there was an issue on the county's end with the detainer request. So just wanted to ask, were you aware of that, and can you just shed light on how the county is handling that?
So I think Ben Stevenson addressed all of that, but I'll just kind of reiterate. We got a request for a detainer that came in through fax, and because of a mistake, not because of policy, that fax did not wind up where it should have gone, which is to the department. When we released the person, we had a second problem, which was the rap sheet, which is what a person's criminal record is, did not include offenses that actually had occurred that we would have actually would have honored the detainer had we known that. And there was the gang activity as well. So we goofed on our part. We did not make a policy decision to let this person go. Things were not handled properly, and this person did go. I will point out that we made a mistake, and we own the mistake. We did not have a policy that led to this. We had a mistake that led to this. And ICE should understand mistakes, because I recently recall they've made a few mistakes. So mistakes happen. We own it. We fixed it. We've dealt with how we make sure the things that do get faxed to us wind up where they belong. I will point out that, it would have been nice had when they realized you weren't going to honor the detainer, if they had pointed out that this person had a criminal history and was on a gang list, because if they had pointed that out to us, we could have gone back and checked our records and verified that in fact he did have a criminal history, which we were able to verify. So a little more cooperation between the two of us might have been more helpful. But whatever happened was not because we had a policy. And I think people know that, we have honored detainers when detainers involve people who we definitely do not want on the streets of Montgomery County. And we're going to continue to do that.
Thank you so much.
I would just add that Director Stevenson and I actually met on Friday with the acting director of the Baltimore ICE office and discussed some of the changes that we were going to be making internally to make sure that sort of this kind of error doesn't happen again. And we actually asked for their assistance in doing so by having all of the requests be routed to a single mechanism so that we had greater transparency on our end about when ICE requests are coming in, and to ensure that there's multiple eyes on as opposed to a single individual making a mistake that leads to the non-cooperation that we saw in this particular case.
Thank you so much.
Thank you, Mariam. Members of the media, any other questions this afternoon for the county executive and county officials? No more questions? Going once? Twice? Well, thank you everybody for joining us. Have a great afternoon. Stay safe. We'll see you next time.
Thank you.
Yeah, absolutely.
Its mission is powerful. Let's talk about that.
For sure. So our mission is that we're a sustainable care farm where people with and without developmental disabilities come together to work, learn, and grow healthy food. That's our mission statement, and our vision is to create fertile ground to nourish a healthy and inclusive community. A red wiggler is a worm, and they're kind of